Mr. Marchant, you're recognized.
Thank you, Mr. Chairman. Secretary, I represent a managerial type district around the DFW airport, about 15 communities. Most of the constituents are working in those corporations or businesses around the airport. When I have a town hall meeting, the first question I ask is how many of you receive a service from the government? How many of you receive a check? And well over half always raise their hand. And then at the end of the day, most of those people are on Medicare Advantage. So they're getting very good health care, and there are a few complaints about the quality of the health care. But the question I always get is, and the assurance I always give them, is that that level of care is going to continue, that the Medicare system will stay solvent, and the federal government, through innovation, will, with less money, achieve the same levels of care that they're receiving now. Now I get to ask you to speak to them and assure them of what I'm telling them is true.
Absolutely. The deep commitment to Medicare, and especially the Medicare Advantage program, which 40% of our seniors are now enrolled in, and the majority of aging-in seniors are choosing Medicare Advantage. We want to make sure that that works for people and delivers high-quality, low-cost care for seniors. You know, part of my job is to make sure that this program, which is such a bedrock of our society, remains solvent, and that is by taking waste, fraud, and abuse out of that system, by the transformation to value. How can we pay more for outcomes and value? So instead of paying for sickness, pay for good outcomes. So all of that is with an eye towards the more money we can save and the higher quality outcomes we deliver, the better we're going to serve your constituents that are talking to you about these programs and keep it there for them in the future.
Thank you, Mr. Chairman.